Good afternoon. My name is Deanne Fortenberry, and I'm the Diabetic Educator and Program Coordinator for Diabetes Care Services at Stillwater Medical Center. I also provide diabetes education for the home health services as well. I have been doing diabetic education for the past 17 years or so, and have been working with Stillwater Medical Center for about the past 13 years. Today, I would like to take for just a few moments to discuss with you about survival skills related to diabetes care. On each floor or on each unit there is a sheet that's available for patient teaching that's called Survival Skills for Diabetes Care, and it goes through the main topics that I would like to discuss today: the monitoring, the management of symptoms and emergency problems, the sick day rules, and follow-up care. To discuss a little bit about the monitoring, each individual's monitoring orders are going to be very different according to their medications, according to their glucose levels. But some of the things they need to know are how to monitor effectively, what results that they should be expecting, a little bit about how to help get those results a little bit better. Some of the things related to monitoring are global. And one of these things has to do with the actual technique for monitoring. The hands should be clean and dry. Things that can alter the test results may be things that would be on the hands, as far as wet alcohol, lotions, food residue, those kinds of things. And so the best results are going to be from clean, dry hands. Also on the Lancet device, different manufacturers also provide different Lancet devices. But the most important parts to know is how to actually obtain the blood sample. Individuals should not be monitoring actually on their fingertips. They should be using the sides of their fingers. And they shouldn't be sticking any deeper than they have to just to get the sample size specific for their monitor. Individuals will have different testing schedules depending on their food intake, their activity levels, their stress and illness, their medications. But one thing they do need to know is how often to actually monitor and what kind of results they are expecting. For good glucose control, a reasonable average is to have a glucose around 140 before they eat, or if they're testing after they eat, less than 180 as much as possible. Their levels may be much higher than this initially, but they will be working with their doctors and their nurse educators to be able to help bring their glucose back down into normal range. One of the things that's also helpful about monitoring is in logging those results. In logging those results, the most important things that we need to know is the date and the time of the test, what the actual test results were, and whether this was before or after a meal. As we are developing their plan of care, we'll be able to help them understand better how their diet or their exercise or some of the other things that they do affect their glucose levels. They also will need to bring that log result with them to physicians' visits as well as to the outpatient education session to be able to help us gauge a little better how that individual is doing and help the doctors be able to manage the medications better. Our patients will also need to understand how to take their medication safely, at the correct time of day, at the correct dose, and signs and symptoms to watch for and to report to the physician if they're having problems with those medications. As you're reviewing the medications on discharge with your patients, you need to be sure that they understand the dosing schedule and the side effects, and point out specifically those that are related to diabetes as well as those that are new. If a patient is starting new insulin therapy, they should be seen as soon as possible after discharge in the outpatient education setting, as well as have follow-up with their physician soon to be able to help make sure that they are able to manage that correctly. The patient should also have their written information from the pharmacy related to their various medications, but just be sure that they understand how to take these drugs safely. When we are managing symptoms of diabetes, the two main symptoms that are related to diabetes have to do with hyperglycemia, which is a high glucose level, or hypoglycemia, which is a low glucose level. With hyperglycemia or high glucose, the symptoms tend to be a slower onset, and they tend to make a person feel sluggish and tired. It also tends to cause excessive thirst, more frequent urination, appetite changes, sometimes foggy thinking or confusion. And typically, the causes of hyperglycemia have to do with their stresses and illnesses, which is very typical for a hospitalized patient. It will also be related to dietary changes, maybe not enough medication, or maybe not enough exercise. And so if we're able to help them identify the causes of that elevated glucose and help them know how to take their medication safely, they should be able to manage that glucose a little safer. They do need to know if their glucose is running high consistently, more than several tests in a row or for more than a couple of days, then they need to call their physician. If the glucose is low, this is more of a sudden onset symptom. It tends to cause more dizziness, shaking, sweating, palpitations, sometimes headaches, irritability or mood changes, or sometimes a sudden onset hunger or maybe even a little nausea. If the glucose is monitored, frequently the test results will be actually less than 70. The person does need to know how to test the glucose to know what the result is, and they need to know how to safely treat a low glucose level. In treating a low glucose, we use a rule of 15. That says basically a person is going to use 15 grams of carbohydrate, whatever their source of juice, sugar candies, glucose tablets are preferable if they have those, but about 15 grams worth. Wait 15 minutes, and then they're going to follow up with some kind of a protein snack, and that will help elevate their glucose back into a safe range without causing the high glucose levels that frequently follow. If the patient is having low glucose levels more than 2 or 3 times in a week, the physician needs to know about that too. For sick day rules, a patient would need to know that they need to take their regular medication on schedule. Glucose levels tend to be higher when a patient is ill. They should be monitoring their glucose every 3 to 4 hours during their sick days, and they should be having extra fluids. They should be eating as normally as possible as well. If they are not able to eat their regular meal plan, then they may need to have some ideas for meal replacements during their sick days. And that may include some broth-based soups, maybe some crackers, dry toast, maybe even a little bit of a regular soft drink for meal replacements, but they would still go back to the diet soft drinks or water in between the meals, just to be able to help manage their blood sugars on those sick days. They do still need some calories. They do need to call for help if their glucose is running high and it won't respond to their normal treatment, if they're vomiting or having uncontrolled diarrhea, if they've been sick for more than a day or two or they're running higher fevers. It is important to follow up with your physician as soon as possible after the hospital discharge, regardless of whether they are a new onset or whether they've had diabetes in the past, because diabetes does change as their health condition changes, and sometimes they do need some assistance in being able to regain their balance after discharge. Thank you for sharing this time with me, and thank you for taking positive steps toward better diabetes care.